It's a subject that is popular for various reasons. One, it was in the news because a very famous actor passed away from it. We're talking about ketamine therapy, how it could be positive, how it could be negative, and we bring a doctor on who's a specialist in it.
Do not try ketamine without watching this episode first.
All right, Marcus, we talked about him long enough. Let's bring it on right now. Let's see if I give him the right introduction. He's a board-certified emergency medical physician. He's also a physician at the U.S. Soccer Federation, works on the American Society of Ketamine Physicians, founder of Dr. 911, contributor for Times, Forbes, and CBS. You can follow him at Dr. Robert Glatter on X. It's Dr. Robert Glatter. How are you, sir?
Great. Thank you so much. What an intro. I really appreciate the opportunity to join you and Marcus. And
Thank you. As soon as you start talking, Marcus decides to go his ass. That's right.
Well, look, I mean,
you got to settle in.
Maybe this is part of the environment or the milieu we're diving into.
Well, exactly. Ralph, part of the, one of the credits that we didn't give him in your intro is that he's also a friend of mine. We met at Goodsugar.
Wait a minute. Do you think somebody would put on their list of credits friend of Marcus?
No. Just for the show to warm him up a little bit. He's not just some guy in a suit that we found. He's somebody that we know.
Well, you missed it, Marcus. Off air, we have several mutual friends, him and I, because I went on his LinkedIn profile and saw that we had several friends that we knew off air with each other.
That feels very positive too. Thank you.
It's all very incestuous. So first, I told him off air.
But I have to thank Stephen Nitkin for making my intro to you, Marcus, because that's how this all actually happened. So thank you.
So I mean, what we're going to get into a little bit in a moment is that you do a lot of work with ketamine, and I actually have a friend that went through ketamine therapy for his depression. We'll get into it, but just before we get into anything else, I feel I just need to state this to the room. I did not sleep at all last night because yesterday, for my second time, I did PRP therapy in my right shoulder. And this time they said they were going in a little deeper, whatever that means. I don't know. Mm-hmm. And I could not sleep. I was in agony all night. I've been up since 2 a.m. and I just decided to just be upright because if I lay on it or move around, it hurts. It's starting now, 24 hours later, to feel much better. But boy, was that a rough night. What are your thoughts? I know it's not your field, but just curious what your thoughts are on PRP.
No, I'm a proponent of PRP. I actually used to work with the Jets from 04 to 08, and we had a lot of athletes that did this, particularly in the off season. I think it's a very valid therapy. There's evidence behind it. I think that certainly, like as you described, it does produce some pain, but that it's gone in about a day or two.
Yeah.
But the long-term outcomes are very good. We find that for compared to other drug therapies, that the platelets themselves are provide an environment that's anti-inflammatory, helps heal scar tissue. It really is something that helps range of motion and function. So I'm a big believer in it.
Yeah, but what's weird about it is apparently you're not supposed to take like any sort of real painkillers or anti-inflammatories within the 24 hours after doing it, or 48 hours. So you just have to kind of deal with the pain.
That's right. If you do take things like Advil, specifically, it can affect what we call prostaglandins. And so we don't want that as an interference with what's happening with the platelets, because there's a very elegant mechanism that's at work in terms of anti-inflammatory effects. So yes, your doctor did tell you the right advice.
Yeah, well, it's wild. It was painful. Yeah. By the way, and just one more thing. I don't mean to make this about me because you're here. We're going to get into it.
No.
I never had this experience before in my life. The phlebotomist comes in to take out the blood. It's like 30 milliliters of blood, right? And she puts the needle in my vein, and no blood is coming out. And then she starts wiggling the needle underneath my skin. It's like, I don't know why it's not working. And then she takes it out. We do it again. Still nothing. Go to my left arm. Nothing. And I say, look, I think we need to get somebody else here. I don't want to be a pincushion. And then she went out and got somebody else. And that person did it in the first try. So obviously I got a newbie. But boy, that was added just more insult to injury.
Sorry you had to go through that. Listen, unfortunately, it can happen. Do you have good veins, by the way?
I've never had that problem in my life, ever. So,
okay.
Have you ever been asked that question in your life?
Do I have good veins? I've been told actually I have good veins.
Well, Doctor, I'm really excited. I think we could delve into a lot of fields here. I think you asked before we started the show, how long do these things typically last? I actually, if Ralph has to go, I think we should follow a really good structure of things that you want to talk about and things that Ralph think are interesting. And I'd like to go really deep into all the territories that are out there to see what, we need smart people. Between Ralph and I, our IQ is 150.
Yeah.
100
and Mark is 100. Mark is 140 of them, unfortunately. So, by the way, you work a lot with ketamine, right? So we'll get into this one first, because one of my best friends, and I feel I could say his name. Why? They did a profile on him. He wrote an article about the benefits of doing this therapy and dealing with depression. His name's Paul, and he was like a big VP at like Viacom and all that. And I know him since we're 22, and he's been struggling with depression for a very long time. Ketamine and doing what I think most people do, trying different mixes of drug cocktails to find the right balance of which drug works and doesn't, and with mixed success over the years. But ketamine was the first he did electric shock therapy once or twice, and that worked to some degree. And then he started doing ketamine. He said it was the first time that he really felt like a new person, or like realigned, or whatever you'd call it.
Yeah, ketamine is a transformative medication. It's been around really since the mid-'60s when it was first synthesized. It's actually a derivative of PCP, which is a true psychedelic, but in the way we use it medicinally and therapeutically in the clinic setting in our practice is not as a psychedelic. It's used at low doses. When I say psychedelic doses, I'm talking about, I'll give you some numbers, pretty much 2.7 to 3.5 up to 4 milligrams per kilo, depending on your metabolism, your lean body mass, and your adipose stores, can make it a psychedelic experience. So there is variability. But when you start at a low dose of 0.5 milligram per kilo and give it slowly over 90 minutes or 75 minutes, depending on how you like to approach it, but do it in a very systematic, controlled setting with an intravenous drip, it produces a calm, floaty, and relaxing experience. And that's what I want to drive home. And in that sense, it's not actually about the experience. And let me explain. Ketamine acts in a delayed fashion, and that means 12 to 15 hours after the infusion. So in truth, nothing therapeutic happens as you receive the medicine. It feels good, it's calm and floaty, wears off in a few hours, but the real effects begin later. And that means 12 to 15 hours and then really in the days after. So when people start to feel better, they say within often a day or two. And it might be right after the infusion. However, the reality is it's a delayed response. And that's what I want to make clear to our audience. If I may ask,
just for context for me. So you're saying it's a delayed response. Are you, when you give it's done through an injection, correct?
Intravenous.
Okay.
Not intramuscular, IV.
Okay, IV. So it's done through an IV. The average person with a clean diet, I want to create some parameters, and who's not progressed further. I'm not a psychologist. I don't have terminology, forgive me, but who's not progressed further down the line of certain types of mental illness. Let's qualify them as being somewhat normal. How long after the drip begins will a person begin to feel what you said was floaty?
It takes a few minutes. For the first 1 or 2 minutes, they may not feel much, but then it's a very gradual progression. It's almost like going up a roller coaster, very gradual, slow progression where then it peaks. For example, with the first infusion at 90 minutes, peaks at 45. But it never is a frightening or scary experience. When you take a lozenge under the tongue or do an intramuscular injection, it's a sudden, jarring, disconcerting feeling. You're sort of catapulted straight up. Different than ketamine, where this is sort of a gradual process where you then peak at 45 and then come down. And again, that's the first infusion, but subsequent infusions are typically about an hour. We condense the speed, and that speed of infusion is very critical in your experience. And again, when I say experience, that some people like to have a dissociative experience, which means being slightly apart or separated from your body. Mm-hmm. Now, there's certainly a spectrum of dissociation. And as it gets further and further, more intense, then you get to a point where you start to have some dangers. And that approaches the psychedelic levels where we talk about things like K-hole rather, which is sort of a,
Oh boy.
you know, like a near, we call it, you know, it's a scary, frightening type of position to be in. You lose your bearings, your surroundings. You may feel you don't know where you are, who you are. And that creates what can be a very dangerous situation, especially if you're by yourself using ketamine. And that's what is my point. And that is something we never approach in the therapeutic in-clinic office use.
So you don't recommend that teenagers buy this on the street and hide in their closet and take it on their own, listening to dark metal.
Absolutely not. This is something certainly in recreational use. People snort it, they inject it, they may put it in a drink. They use it at very high doses.
Can you hold on 1 second? I'm sorry. Ralph, can those sounds get edited out?
Yeah, I'm going to figure out how to mute myself next time. I apologize.
Only just because it sounds like someone's dying in the hospital.
I am dying. I'm sorry.
and what I would say is that this is purely just for theatrics. This statement, just from what I react. Your answers are beautiful. They're unbelievable. I mean, I'm so excited about this. We can go on. I think you're triggering so many questions for me. I'm almost I'm almost like so excited. So I want to try to create a trajectory. Like when you said the word peak, I wrote notes, but I wanted to get into what your definition of peak is, so I could really follow this, because it's stirring up a lot of thoughts for me about the intersection between psychology and what you're doing as a medicine person, if that makes any sense.
Absolutely.
Okay, so going back to where we left off when Ralph was
a little epileptic seizure. Yeah.
Sorry. Okay.
Exactly.
Pick up that thought right over there. I'm sorry if you have it.
Right. So again, it's a progression as the drug starts to enter your body. It crosses the blood-brain barrier, washes over your brain. Certain areas, specifically the prefrontal cortex, the amygdala, and the hippocampus. These are our mood centers. And so what's happening is that as you infuse ketamine, it's blocking a specific receptor known as the NMDA receptor. That receptor lines many types of nerve cells or neurons. By blocking the receptor, first and foremost, you prevent the reabsorption of an excitatory neurotransmitter known as glutamate. Glutamate is a different type of neurotransmitter than serotonin, which is what people typically think of, for example, when they're taking an SSRI, like Zoloft, things like Prozac. Very different mechanism. That's the serotonergic or serotonin mechanism, which does affect, your mood, your appetite, your energy. Now the NMDA pathway was something that was discovered in the 60s, noted to be a very, more interesting pathway because of how glutamate functions. So when you elevate glutamate, you elevate a protein also known as BDNF, or brain-derived neurotrophic factor. BDNF is critical in order to maintain the density of synapses and dendrites, which are the connections between our three main mood centers, the prefrontal cortex, the amygdala, and the hippocampus. The amygdala is an area of fear, aggression, and anger. There are things here that will akin to the fight or flight response that are stored that trigger things like anxiety, elevated heart rate, palpitations, feeling very anxious, restless. Now, these types of feelings, and along with this type of feeling, is basically, I would say, akin to forming also a memory at the time that gets consolidated in the area known as the hippocampus. So memory consolidation from the amygdala is transferred to the hippocampus. And so when you grow up with, say, difficult parents, maybe there's conflict, there's fighting, there is a home where there's violence, physical violence. This produces basically an elevated level of cortisol. So high cortisol is bad for our bodies. And this is different than the cortisol rise that happens as you wake up and as you go to sleep. This cortisol rise during childhood, when your mood centers are developing from birth until our late 20s, produces a lower level of BDNF, or brain-derived neurotrophic factor. You need BDNF in order to have this adequate density of synapses and dendrites to connect the mood centers. So without that, your mood is off. You either are anxious, you're depressed, you might be craving food, you maybe have mood swings. And so when you infuse ketamine, what you're doing is elevating the level of BDNF. And by doing so, you then connect the mood centers because you're increasing the density of synapses and dendrites. It's all about connectivity. And that's what makes your mood really brighter, lighter. You sleep better.
I have a question too, Marcus, but you want to go first?
Absolutely.
So you go first.
So my question is, was it BDMA? Was that what you called it?
BDNF, brain-derived neurotrophic factor.
When you're taking the ketamine therapy, and it's, I would say, repairing or making more dense, however you described it, for this connectivity.
Correct.
Is it permanent, or is this something that you have to continue to do for the rest of your life?
That's a good question.
That's a great question. And so this is how it works. Ketamine doesn't act in perpetuity. I'll be very clear about this. It does require boosting for the first year. After that year, 8 and 10 patients that do 6 infusions and then about 3 to 6 boosters in our practice on average don't need to see us any longer. Why? Because they're feeling better, they're functioning better, their mood's improved. Now, 2 and 10 patients still needs about 1 to 4 infusions a year. We don't see that as a failure. It's more maintenance. And I want to be clear that we're not against medications. Medications, act on a chemical level, whereas what we're doing with ketamine is a structural repair, connecting the mood centers in a positive way. So 2 very different approaches to treating depression. And so that structural repair is what, Ralph, to your point, is that after a year, in most patients, you don't need it any longer. That's the answer.
Oh, that's good. And then also, is there a test, or is it just a psychological analysis to decide if someone is the right candidate for this type of therapy? Or is it just someone that says, I just don't feel right? Like, how do they qualify to be someone that says, okay, this is something that we should undergo with you?
All right. So the kinds of patients we treat typically are those who've had childhood trauma that elevates cortisol, lowers BDNF. We're talking about patients that have mood disorders, depression, major depression, treatment-resistant depression, meaning that they've had multiple medicines, at least 2 that they don't respond to. We also treat patients with bipolar disorder, manic depression, we'll call it. It's mood swings. Bipolar depression is exquisitely sensitive to ketamine, and we see significant improvement there. We also treat OCD, which is really part of major depression. And so when you treat depression, the OCD symptoms improve. We don't treat patients who are psychotic or acutely manic, patients who have elevated blood pressure, because ketamine slightly elevates heart rate and blood pressure, but only to levels, say, of when you're exercising. But that said, we don't want to treat patients who are in the throes of addiction, specifically addicted to stimulants or other, certainly illicit substances. We want them to be in a program prior to beginning treatment. Elevated levels of alcohol intake and cannabis can impair the ability to respond to ketamine. So we have to have that at a very minimal to moderate level prior to beginning the infusions. And I want to be clear, that's something that's very important.
You said one question, Ralph.
Sorry, go ahead. Go ahead, Marcus.
Yeah.
Come on, man. Pull back. You're like a caged animal over here. No, it's an interesting subject. And off the record, like if we have to turn off, I'm going to ask you a couple of questions that you could just say you don't want to answer, but I think they're, I got to ask them because they're tough questions. And that's what came up for me. And so, and I actually want to lead into what I think is really positive to what you're talking about and your cause. But I also, at the same time, I don't want to seem like a dummy just sitting here and I'm not asking something with what opponents to this would do. Okay.
Please.
So, first of all, I think it's amazing how medicine can work. And when people struggle and suffer with things, they shouldn't struggle their whole life. If there's a way to do intervention with minimal risk, then that's the beauty of science and medicine. Obviously we have to look at everything really carefully. The first thing, and I have so many positive things to ask you, I just want to ask these questions because I think they may be a little bit more tougher. Is your philosophies are pure, no doubt, but do you financially benefit from the ketamine manufacturer by selling the product, and is that part of how you earn a living? And I'm not saying it in a derogatory way. I just want to establish myself where there could be any biases as you and I went deeper and deeper into a conversation, just as much as I have my biases.
Right. I mean, look, the practice is a business, and certainly we have to provide a service at a given level where we can, provide this at a high level. Now, to your point of how the process has played out, the FDA approved the drug in 1970. We know that. It stayed on patent until 2002, and that was through Parke-Davis. Now, when it came off patent, obviously it's a very cheap, inexpensive drug off patent, and no one wants to own the revenue stream for that matter. And no pharmaceutical company wants to do the studies to invest, it could be $750 million to get it FDA approved. And herein lies the problem. Because there's no profitability of a cheap, inexpensive drug that's off patent, that's why it remains off label and how we use it. And that's really the crux of your question.
But it's regulated by the FDA. Side question, it's still regulated, obviously. Correct. Okay, and so just to say that what's fair to say is that there's a tremendous amount of science, but this would be outside of the medical community of what would be prescribed. And so technically, if I was like a very high degreed, hoity-toity guy from a great university, I might say that you're in the supplement business. I'm sorry if I'm mischaracterizing it.
No. This is definitely not a supplement. The drug itself has been shown through hundreds and hundreds of publications that started at Yale in the mid-90s through a Dr. Gerard Sanacorda and John White that looked at ketamine intravenously and its efficacy. And since then, the studies have extended to National Institutes of Mental Health, but also here in New York locally at Columbia, Mount Sinai, NYU, with very important research. Now, again, the fact that it's off-label doesn't really mean that it's not an efficacious drug. Look at Ozempic. I mean, it's being used off-label for many indications for non-diabetics. Look at cancer drugs. Cancer drugs are used off-label daily in our country. Part of the problem is the system of approval. Should this be an FDA-approved drug? Absolutely. I think all of us agree. Look, the fact is that there's 500 to 750 ketamine practices currently in the United States based on recent data. And it is a business. I'm not going to say it's not, but this treatment is not widely available to the public through traditional channels. And that's really
all medicine is a bit. All medicine is a business.
Let me ask you a couple of questions.
Hospitals, a business, doctor's office. I don't think there's anything to be ashamed of with that.
Is it fair to say that if there wasn't the detachment floaty vibe that you get from ketamine and you just got the repair part of it, people wouldn't be so against approving it because it's used recreationally as a drug? And that kind of, is that what maybe taints the view of the drug? Is that possible, or am I wrong there?
I think that's possible. Look, people do enjoy the experience. It's a very common, relaxing experience as you described. Now, it remains a Schedule III drug, which means it has the potential for abuse, specifically psychological and physical dependence. We know that. Now, look, other drugs that are Schedule I currently, like cannabis and MDMA and LSD, those are Schedule I with, in other words, no accepted medical use. But ketamine has medical use by being Schedule III. At the top of the Schedule I are drugs that have no medical use, and Schedule V, which have clear medical use. But again, yes, the potential for misuse and abuse has led to the problems that certainly we know about through popular culture and celebrities recently, obviously Matthew Perry. But that was an instance of abuse, not therapeutic use in an in-office setting, which is I want to drive home to your audience that ketamine is safe. It's been on the World Health Organization's list of top 10 essential medicines since 1985.
When it first got studied, what was it studied for? When you said it's been on the radar since the 70s, what we said, was it always for this purpose, or were there other purposes that they thought the drug had?
Well, basically, Parke-Davis looked at the drug in the early 60s, and they looked at PCP and tried to take a view of it as, can we make this drug somehow therapeutic? removing the dissociative aspects to some extent. They took basically the drug ketamine is a combination of an amine and a ketone. So therefore the drug is called ketamine. So there you go, ketone and an amine. When you take those two types of, exactly. And that's where I think you had asked me by email, how did we get to this name? Well, it's a scientific name. But again, they reduced the psychomimetic properties when they synthesized ketamine. And what do I mean by psychomimetic? We're talking about hallucinations, delusions, and episodes of psychosis. That was the reason they looked at the drug, because they said it could be an anesthetic, and it has evolved into that and is that. And it can be a dissociative agent, which is very useful when you're doing, say, procedures and you want patients not to have recollection of what you're doing to them. Let's just say I set a forearm fracture. I give a person a dose of ketamine. They don't feel the pain. They're dissociated. They're in a different space.
Dosage is that?
They have
that they
at the dose. So 2 milligrams per kilo would typically be a dose in a therapeutic setting in an emergency department to relocate a joint.
You said
set
10?
a fracture. 2 milligrams per kilo.
2 milligrams as opposed to what
so we're doing half point. Right. Correct. We're using at the low dose. We use it. Again, it's a very dreamlike, floaty state, calming. You don't have any hallucinations. You don't have delusions. You do not get any type of frightening experience.
It's relaxation. It's relaxation.
Relaxation.
Okay.
Right. And that's why I say, so people enjoy this experience. If you're suffering from depression, anxiety, this is a respite from the storm. This takes you to a different place for that hour infusion. Now, it wears off in a few hours. It's out of your system. But there's nothing, in my view, that's negative about having a pleasurable experience.
Nothing.
If you're suffering,
that segues. I think that segues me out of the technical details and more into how this aligns with the increase, the resurgence or the surge of plant-based medicines like ayahuasca or even cannabis and stuff like that. So, Ralph, do you have any tech questions that you want to?
Well, my last question. Hold on. Sorry, Brian. You have to cut this out for a second.
No, don't cut it out.
Okay. Sorry about that. Have you had patients that came to you where they wanted to come back before their proper time because they enjoyed the floaty feeling too much? You're like, no, dude, you got to wait another month. Like, it's too soon. You know what I mean? Like, I'm just curious if that happens.
No, we don't see that in our practice. In fact, we don't see any abuse, dependence, or addiction when you use it at the low doses. And that's what I really want to drive home. As you go higher and higher, we're talking 2 to 3 milligrams up to 4 milligrams per kilo. When you go to those higher doses, yes, you can create some psychological craving, but we don't go there. Okay. And so when people say snort ketamine, they get a quick hit. It accesses the blood-brain barrier within really a second or two. And it's that reward that you get. So yes, people crave it when you snort it. If you
you're not injecting euphoria. You're injecting relaxation,
calmness, pleasure.
Let's say that on a scale of states of mind, starting with relaxation, you can move into orgasmic and euphoric, and that's not what you're delivering. You're saying this is the point of this is reparative, and it gives a sense of relaxation. In that state of relaxation, if that is where it gets interesting, and so I would like to see what your work around this is, because in theory, if the patient can stay relaxed, not drunk, not unconscious, not hallucinating, are they now introduced into certain types of psychotherapy? Are they given reading material? Are they instructed on meditation? Is there any interaction in that to guide the person to really go where they could go in a relaxed state?
Right. And that's a great question. So what's happening, again, is not therapeutic, meaning that you're not creating dendritic and synaptic connections as you get the medicine. So during the experience, we want people to be distracted. So whether listening to music, watching a video, listening to a podcast, maybe ours, it's all about distraction. So in other words, teaching people that they need to push everything out as best as they can. not pick affirmations, not pick intentions, to just let go. Imagine the sun is setting. Yeah, the sun's setting.
Zen. You're a Zen
You're on a
guy.
beach. Yes.
You're a Zen guy. Why didn't you just say that from the beginning? I didn't know that. You're extraordinarily brilliant guy. You're very technical. And I imagine that the first stage of this enterprise has to be waddling through all the technical details. I should have said that, I'm definitely a proponent of intervention at the right dosage, administered by the right person with the right intention, because I've seen it work 25,000 times on all different levels, not just with a drug like ketamine or something like ayahuasca. I think about it in terms of serving food to people on a very low level. We're basically changing their chemistry for a minute. And so the question then becomes what you're doing next to say, okay, now that this person is in this state, what can we deliver to them next? That's really what I'm curious to see.
Right. And so we don't do intra-session therapy. First of all, at the doses we give, you're not able to retain bits of information if a therapist was to sit with you and to try to guide you through a journey. And I say that with complete integrity and honesty. Your recall, your ability to consolidate memories, if I speak to you at these doses, you'll not be able to do it. And for example, if you try to read a book, you'll read the same page over and over again. Your attention and focus and concentration are limited, but that's not a bad thing.
No, so you're forced into the present moment.
Right, that's right. So you're experiencing a state of euphoria, but it's about distraction, about not thinking about anything negative, about staying positive, about listening to music with, a very upbeat, positive tone that puts you in a very happy, enjoyable space.
Is it safe to say that what you're saying somehow and again, I'm not a doctor, I'm the dumb guy. Is it safe to say that you found a substance that you have seen over and over again satisfactorily deliver people from sympathetic brain to parasympathetic brain?
Essentially, that's what we're doing. We're increasing. You just got it right, man. We're pushing that. We're really tamping down the sympathetic nervous system. We're elevating this chemical glutamate that makes you feel good. It happens within, again, about a 24-hour period. We're increasing this BDNF, but we're also hitting other things. We're elevating serotonin. We're elevating norepinephrine, which acts kind of like an SSRI, but without the side effects. So that's only doctors have any idea if this is if what you're saying is critically important, because this is a fantastic interview to me. I mean, I'm not a good interviewer, but I think I'm more of a debating jerk, right? So
just jerk.
Thank you. I think it's really fantastic because that's how I will walk away communicating it, like in a positive way. I'll say my thought process is that this is a substance that's being studied. It's generally considered safe. The side effects are very well known. There's data. It's been around for a really long time. Here you have a brilliant doctor who's not Willy Wonka. He's saying it very clearly. This is what it's designed to do. And so if a person has chronic anxiety, they're not becoming enlightened, whatever it is, and they're struggling, right, this is a very viable approach. The question then becomes, how much is it?
Well, I'd have to have you call our office, but
great answer. Very political.
I'll be very honest with you.
Before we get into the happiness of it all, I have one last question, Marcus. Is that
yes?
You brought up Matthew Perry, right? So my question about that is that I didn't follow much about his death, but my question would be, was he doing ketamine therapy and then went and got ketamine, or was he just using ketamine recreationally? You know what I mean? Like, then I would worry if I'm someone that's looking to this therapy, he transitioned out of therapy to recreational, or was he never under doctor therapy ketamine? I don't know.
No, he was actually being seen by a doctor in Los Angeles that gave and administered him intravenous infusions. The last time he had received one was roughly a week to 10 days prior to his death. So he was using ketamine illicitly. And so that is either snorting it or by injection or by a nasal spray. And that produces these feelings of instant euphoria. And that's the craving that I talked about earlier, that when you use it through these routes of again, intranasal, but also, injection or even a lozenge, you get into a psychedelic state very quickly where you can lose sense of where you are. Now, he was in a hot tub. Being in a hot tub, your blood vessels dilate and essentially your blood pressure can drop. You can also, at high doses, lose the ability to have a sense of your surroundings. So you lose that continuity and that grounding. And that lack of grounding probably let him slip down, and then unfortunately he drowned. And that's what we know. And that's so far as what the public knows. Like, I have no access to medical records, to the ME or anyone who personally saw him, but that's my impression of what happened.
It's misuse. It's misuse of the substance. Yeah. It is a tragedy, and we should say that it's unfair to put that as a shadow on ketamine, because it happens all the time with every other substance on the planet Earth.
I was just curious. I think it's a fair question, but I get it.
It's a fair question, but what's clearly being said here is that with any medicine, plant medicine, Advil, whatever you want to call it, cinnamon, there's always a dosage, there's always a prescription, and medicine turns into poison really fast if it's misused. That's it. End of story. So it's every drug or any medicine, whether it's cannabis or the coca leaf, however you turn it into something, if it's not taken with a sensible prescription, it's over, right? It's a different compound. It's a different story.
Right. And I think that's really the take-home message, Marcus, that, misuse and abuse leads to problems. And unfortunately with Matthew, that, it did venture into that area. In our practice, again, we don't see abuse, dependence, and addiction at these low levels. In fact, the low levels of ketamine use are so effective for treating anxiety, depression, bipolar disorder, OCD. This is what this is who we treat. People who've had childhood trauma, abusive parents, parental neglect. We're talking about bullying. People who've been bullied when they grow up. They have this elevated cortisol and this stress response and the lowered BDNF. And again, ketamine raises the BDNF, allows synapses and dendrites to form, makes you feel better. And that's really the crux of it. It's a very simple thing. Now, let me explain. In mice models, when they knock out the gene for BDNF, the mice do not respond to ketamine. So there is a genetic aspect to this, which you may find interesting. So every person is born with a certain number of copies of the gene for BDNF. I don't know how many you have or Ralph has. And that may determine your response to ketamine.
I have a lot.
Oh, that's good to know. But listen, the reality is that the number one predictor of who responds to ketamine, and I'll be very blunt, is people with a miserable, difficult childhood. And that's across the board. If I interview you and we do intakes in our practice of who's a good candidate for ketamine, if you went through horrible abuse, if you were bullied, if you had difficult parents, if you had parents that were neglectful, this can put you at risk for having disconnection of your mood centers and lead to mental health issues. Look, 1 in 4 people in the United States have a diagnosable mental health disorder currently. I want to just put that statistic out there.
How many?
25% of the population.
And what number of people do they predict that they're not reporting for because there's no data, because people don't really talk about it?
I think 25% of astronomically high.
Well, I mean, I think the number's higher. I think it's closer to 50%, maybe higher. Look, depression is the number one cause of disability in the United States among people between the ages of 15 to 44. And that's from data from National Institutes of Mental Health. That really speaks to, the problem of depression that we are facing. We have a crisis of overdose deaths, the youth mental health crisis, but looking at the data of just depression, in the ages of 15 to 44 as the number one cause of disability in the United States, that speaks volumes. I mean, we're talking about a tsunami of mental health problems. Now, ketamine is certainly one of the things we use to treat mental health issues, but along with medications, which again, we see as stabilizing, ketamine is an adjunct. And I want to be clear that we're not trying to speak negatively about medication. Okay, medicines are helpful. The SSRIs, SNRIs, they do stabilize people. But ketamine serves as an adjunct in doing a structural repair as opposed to a chemical approach. And that's the difference I want people to understand. It's a different approach to treating mental health disorders.
It's the physical approach. I understand, because what you're suggesting is that if the compounds and the tissues of the body were undamaged by how the brain forms when a person is in crisis, when they're developing, you're saying if this wasn't damaged, then consciousness would be in a positive state of mind. So you're taking a physical approach to saying if we could repair this, then a person has a chance of getting back into the positive frame of mind. But it's up to that person what work they do. It's not the important thing is to recognize is that there is no happiness drug that you just simply take it and it's over, you're done, and all your character defects wear off and all the patterns that you've been following your entire life, they're suddenly disrupted. But there is sort of like that major life disruptor. Like, let's say a person is just living a terrible version of their life. They're stressed out, they're angry, and all of a sudden they have an explosive heart attack, God forbid, and then they end up in the hospital, tied to machines, stitches all over their chest, and all of a sudden, boom, they had the awakening they need, and the spiritual awakening is there, and they demonstratively, without effort, come back to living in accordance with the natural pattern that the mind was created to have.
Right. I mean, look, what you described, even being hospitalized can be traumatic. There's something called the post-ICU syndrome, which, when you spend time in an ICU and you hear alarms and it's very stressful and frightening, there are patients who come to us, even that being the trauma they went through. So you hit upon an important part. Just being hospitalized is traumatic and going through that. So again, there are situations in life, even beyond when our mood centers form till the 20s and 30s, people go through a divorce. They're certainly going through a difficult relationship, a breakup. Someone passed away.
Life.
Ketamine can be exquisite. Life is stressful. You hit it. Right.
Just all your hang-ups, we did a calculation yesterday. I was talking to someone. In the first 20 years of life, when you remove the time that you're sleeping, you have about 20 million or so minutes of consciousness. Let's just say my number's off by a lot, okay? But it's something like that. That 20 million minutes from the minute you come out of your mother's body, there are so many opportunities for shit to go wrong. And, I was thinking about, I was trying to make a list of things that really would never fly in the radar zone of what people think of childhood abuse. And so most people think they had a wonderful childhood because the word abuse creates such an extreme standard. And we don't think about all the things that are tiny that the mind needs to grow intelligently. And so by the time we're 20, we have all kinds of miswired things and perspectives of reality that are unfortunately perverted and corrupt. And you don't need any data to support that. Just look outside your window at the shenanigans, even though the world's in a better place. But just look at what's going on outside. There are people who are walking around, including myself, who have damaged self-esteem, who didn't in every way grow the way that we potentially can. And without having regret, what we're trying to say is, it doesn't matter what happened to me as a child. My childhood was shitty. What matters today is that we muster together as a unit, as a species, to try to fix that, to break the pattern, so that we can give the offspring a better opportunity to be happy and not to fuck shit up the way that we do. Hallelujah.
Are you suggesting everyone do a dose of ketamine?
No,
together?
I'm suggesting that ketamine is just one approach, right? You can go to a Zen monastery and breathe for 5 years.
I'll tell you,
that'll take you there too,
My big takeaway from this, doctor, is the whole idea of repairing as opposed to just like, I don't know, I always thought it was just like giving you a euphoric feeling and you're going to pull from that going forward. But the fact that it's actually doing repair work to the brain that you can actually see is a big difference.
Yeah, I'm glad you realize that. It's a reparative process. You're restoring the density of synapses and dendrites. Remember in high school biology, those synapses are the spaces that have the chemicals.
I was sleeping.
Those little.
I know exactly what you're talking about. There's a lot of stuff. There's no empty space between those synapses. It's just a question of how quantum. How many times have you used ketamine?
Myself?
Yeah.
Oh, okay. Well, I'll be honest with you. I had some
I'm
long
on it
COVID
now.
symptoms. Yeah, I'm sure.
I'm on 10
All right.
milligrams right now, man.
Right.
Can't you tell?
Okay. In fairness, so I had some long COVID symptoms and had tinnitus, which is ear ringing, and had difficulty sleeping, and that produced some degree of anxiety. And I went through a series of ketamine infusions and did some boosters, and it was extremely helpful. And so I want to just say that I've been through the process. I know what it feels like, and so I can relate to patients when they're going through this.
Unlike most doctors who, when studied, and you know this to be true, many doctors. Let me say it correctly. Many doctors, when asked, said they would never take the drugs that they prescribe to people.
Well,
and
look,
you should,
I think,
and I don't have the research. I'm sorry if I sound like a quack guy.
No, it's okay.
Right.
I think that there is certainly ketamine is a controlled substance, but it's used again in a therapeutic manner, as I did it, under supervision. And that's what I want to drive home. When you're under supervision, when someone's there to monitor you, again at these low doses, ketamine is a very safe and effective drug.
It's like having an LSD buddy. It's like having an LSD buddy. You don't take LSD by yourself when you're 15.
Right.
Word of advice to any of you 15-year-olds who listen to this program.
Yeah. Look, it doesn't affect your breathing, your airway. It just slightly elevates your blood pressure. It's a safe drug. You can, I've given this drug tens of thousands of times in my career, again, at high doses to patients in the ER, but also in our practice here at very low doses. And again, I don't want the public in any way to be afraid or scared of this drug. We treat patients in our practice in the 60s and 70s and a few in the 80s that have had significant responses. So even as you get older, there is still a significant response. We're achieving a response rate of as high as 84% based on our last year's data.
How many patients have you treated with this?
We've treated close to 8,000 now since we began we opened in 2012. Yeah.
Kudos that you took your own medicine and know the experience. That's all. That's really important.
Yeah.
Does the 80% metric hold true regardless of the age range, or is it at all gender related, or is it strictly like across the board? It's about 80%.
That's a great question. So people who respond quickly are often young females. And the reason is that estrogen is synergistic with ketamine. I don't know if anyone knew that, but so just being female is a big bonus. Now, people in their 20s, 30s, and 40s, and even up to the 50s have this up to 80 to 85% response rate. And that's an improvement in your mood, your function, waking up with better energy, no rumination of thoughts, no intrusive thoughts. In the case of maybe if you have some passive suicidal thoughts, those being alleviated, because that was a big part of the ketamine reason for using ketamine in the late 80s and 90s by the Army. They did this for veterans coming back from the Gulf War. And that's when they truly realized its value in alleviating suicidal thoughts, intrusive thoughts, rumination, and depression. People who could barely pull themselves out of bed. These soldiers who came back got these infusions. And that's what truly led to the research at Yale and NIH, apart from the animal work that was noted earlier that showed proof of concept.
I want to ask one question on that, and I want to keep him forever, Marcus. I could talk to forever, but I remember reading something about those studies where they gave PTSD sufferers drug ketamine and it felt better. But a lot of it had to do with being in isolation versus being around family. And when they did the same study and looked at people that had good family relations and good family ties, that crazy high suicidal rate dissipated dramatically. Are you aware of that or no?
I am aware of that. So support is very important, and certain loneliness and isolation can drive a lot of the symptoms of depression, suicidality, and sort of, detachment, derealization. So yes, there is that aspect. And that goes to the point that when you're undergoing ketamine therapy, it's important to have lifestyle change behaviors in addition to doing ketamine, whether it's meditation, deep breathing, breath work in the general sense, dietary changes, Marcus, to your point, with the gut microbiome being very important in terms of brain gut health. And so that feeds into it. So when patients undergo ketamine, we want them to have a therapist to integrate, not again to talk about the experience of what they felt during the infusion, but when they're feeling better after, in the days after, to integrate say, difficult issues or problems they're going through in their lives. That's integration after the infusions.
I think integration, that's from a commercial perspective, that's more effective is character development, because we can spend 100 years here getting people to talk about their feelings, which is very important and valid. It just might not be fast enough before somebody runs out of time. So I think what I believe is that you're treating people that, although they have very negative feelings, even passive suicide, as you said, they're probably high functioning people. Is that correct?
Yes, these are high functioning professionals that are working,
right?
Have families, but they're struggling. It's a lot of work.
They've managed to carry the burden of negative emotions, and they're surviving and they're functioning. They're doing their thing. So what I'm saying is, this is it's not a prescription for everyone. This is, if somebody who has severe mental illness or psychotic, as you said, is really not inside, and that's fine, because it's part of what I would say a self-help program. It's a booster rocket to get further into the orbit of the Earth, so to speak, so that you can then peel back the onion and say, okay, now that I'm relaxed and I'm not in sympathetic brain and I'm not in fight or flight, I could learn to apologize more often. I can learn how to be more assertive. I can catch my negative thinking. All the character defects that sort of never really get fixed, because we all seem to envelop our problems in a protective bubble, and it just takes a very long time to fix it. Your belief is that this is a penetration in who the hell's talking right now? Where is this all coming from? Do I sound like a blithering idiot when I'm talking?
No, you sound like a very well put together person who's speaking.
I was so confused when you said that, Marcus. I thought you was talking about someone else who's talking in the background.
No, I feel like I don't, I'm sober a long time, and this is not something for me personally, but as not going to go into the background, but in 12-step recovery, I've had so many people in my life that I've worked with their recovery, and I've seen really high functioning people that have persistent addictions or persistent depressions, and they're just really stuck, and you can't give them anything to do that's going to fix them. Then you'd think that the next thing that's going to happen is they're going to throw themselves off the bridge, but they somehow over 25 years managed to fix themselves. How many thousands of people I know suffered needlessly, didn't find the relationships, didn't necessarily become parents, didn't necessarily have pets or pick the career that they wanted because they couldn't have a breakthrough. And so I believe in what you're doing, even if one day it's said, well, this isn't the right thing, there's something better. It doesn't matter, because I think it's piercing through a very necessary layer that speeds humanity along. The more people that do things like this and get positive results, the more we're helping collective consciousness.
Absolutely. I mean, what you're essentially saying, and what I want to reiterate, is that ketamine produces some distance between your thoughts and emotions so that you can face life stressors. You can navigate things that are difficult. It's not detachment. It's not depersonalization, not derealization. It's simple distance. That distance does not, in other words, that distance allows you not to be triggered. It allows things to roll off you. The sun is brighter.
Well, it's a metaphor.
Easier. Decisions. Well, yeah, decisions are easy.
Why a lot of people don't get what that means. It sounds too abstract. Distance.
Okay.
What you're saying is it could possibly be a little bit of a numbing agent. It's numbing some of the negative chemistry. Because otherwise, what would this mean? You're not physically leaving or going somewhere. What does it actually mean?
Well, it means in the after. In other words, in the days after, we're talking about distance, not during the infusion. I want to be very clear about that. The feeling during the infusion goes away in 2 hours. And again, it's an enjoyable experience, but it's the time after and the weeks after, because the doses are additive. We do 6 doses within 14 days. These doses add up upon one another. And that's why the protocols were investigated in the way they were, because they noted that when you stack doses close together, you get that explosion of connectivity. And that close administration is vital to the robustness of the repair, we'll call it, with ketamine. So if you spread these out over a month, you're not going to get the same effect as you would do it over 14 days when you load a patient. Now, at some point, I want to make it clear that your mood will dip after you have 6 infusions. That dip will occur typically 4 to 6 weeks after the last infusion in the series of 6.
You just go back to being an asshole.
Not quite.
No, but it has to, because it's like it's an obvious thing, but maybe the person did something properly in that 4 to 6 weeks, and now they have new patterns, so that could keep them in a zone. Like maybe they got on that diet or going to the gym or got a new
but
job.
We know
cumulative.
But it's part of the physiology. We know their mood will dip. Part of how ketamine works is that you need to have it boosted for the first year in order for it to be effective as a treatment for anxiety, depression, PTSD, all the things we mentioned. That boosting is critical. So if people, in other words, don't call us when their mood dips, they can backslide, snowball, their symptoms get worse. So when you boost quickly and you get them back up to where they're feeling good, that's very critical. And so 3 to 6 times in a year after the 6 infusions, that produces that 80% statistic that I discussed, that those types of patients who do the 6 infusions and then 3 to 6 boosters don't need to see us anymore because they're functioning better. They feel better. And that's the take-home point to all this.
That's great. Marcus, we're really running long with this guy, Marcus. So I feel like we're being...
Hey, you know what? Some of these podcasts that run long have... Hey, I love this conversation. I think that...
Well, I would rather do this. I'd rather bring him back on again. Let's get some listener questions and we can do that. I think that'd be way better.
What are we promoting for you so that when we're wrapping it up, we can...
I see. I wanted to talk about New York Ketamine because that's my practice. If it's possible, that's
of course. That's why we're here.
If I can. So Dr. Glenn Brooks founded our practice in 2012. He's an anesthesiologist trained at Harvard and really saw an important aspect to ketamine as part of his work in anesthesiology. And in opening our practice, we were one of the first practices in the United States here in New York. He saw the vision in the future of ketamine. And so, again, we've treated close to 8,000 patients. And in that period, again, our response rate in the last year has been 84%, but it's been even higher for many patients. So, again, if someone told you had an 84% chance of a response to a drug, wouldn't you say that's pretty good? I mean, in terms of odds in Vegas, that's not bad.
Right.
8 and 10 chance of winning. I mean, come on. I mean, look, the SSRIs work 40 to 50% of the time. They take 4 to 8 weeks to work, lots of side effects. The reality is people often can't tolerate them. We see patients who've often taken a number of medicines. They're not getting better. Their psychiatrists refer them, or they just get self-referred. In other words, they do research and they find us. We're happy to treat people who don't have a psychiatrist or a therapist. Now, that said, we'd like to have support because it helps with integration. But I'm happy and we're happy to treat patients who choose not to go the traditional route. Okay. And that's something that I want to make clear to the public.
I appreciate your openness. Where's your what's the name? Where's your practice? How could people find you? We're going to put it in the links, but
sure. Practice is New York Ketamine Infusions. We're at 75 Maiden Lane, the financial district. We also have an office in Westchester. We opened about 10 months ago in White Plains. We also have an office in Melville in Long Island. And so we're available 7 days a week, which is unique from any other practice setting. And so that distinguishes us clearly above the rest. We have the experience. We're not in it for the ketamine experience or to get people in any kind of dissociative feeling well and above. We're in it to treat people medically. And I want to make that clear. First and foremost, we're treating patients who are struggling with mental health situations. It's not about getting people into the dissociative space that other online providers, specifically using lozenges,
people shouldn't go to the practice. People shouldn't go to the practice called coolvibesdude.com. It's probably not a good one for ketamine.
Exactly. And our website is newyorkketamine.com for anyone interested. We're happy to speak with you, do an intake, make sure you're an appropriate person to undergo ketamine therapy. And I think it's something, again, that is transformational in so many ways.
And you're at Dr. Robert Glatter. You're at Dr. Robert Glatter on X as well, right?
That's correct. Yes. And I also have a practice. And I also have been in practice doing concierge work for about 15 years.
Dr.
DR 911. Correct. Yeah. And I enjoy doing that still. See lots of patients.
That's concierge doctor service, right?
Correct. Yeah, I see patients in their home who don't want to necessarily go to the hospital, but certainly if they have to go, I have to refer them.
Right.
And I remain on staff at Lenox Hill Hospital, Northwell Health, and in the Department of Emergency Medicine. So that's my initial training, as I discussed earlier. Yeah.
Great. Marcus, you can follow me everywhere at I Am Ralph Sutton. My other podcast is called The SDR Show. This week we have a brilliant musician who played with Lane Staley in both in Mad Season, and he was in Screaming Trees, and also that comic Dana Gould is on. A lot of good stuff there. The Goodsugar store is on 3rd Avenue and 69th Street. Look for the big yellow sign, no single-use plastics, and go down, eat a good vegan meal with a low carbon footprint. Anything else you want to add, Marcus?
No, if you could get the drummer from Tool on your SDR show, I'd really appreciate it.
I know you love him.
Well, he's unbelievable.
I thank you very much. We'll see everyone next time.
Hey, thanks again, guys. Really appreciate it.